So in this problem, we have a 30-year-old woman who comes in with wrist and ankle pain over the last week. She complains of lack of energy and a dry cough and shortness of breath. Exam shows multiple red lesions that are tender to palpation on the bilateral lower extremities. A chest x-ray is taken and bilateral hilar masses are seen. What lab findings might be seen? So A, hyperglycemia, B, hyperuricemia, C, elevated angiotensin converting enzyme, and D is elevated C-ANCA. So I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be C, elevated angiotensin converting enzyme. So for this one, we have elevated angiotensin converting enzyme, and so this patient has a condition called sarcoidosis. So sarcoidosis is associated with this, but it's also associated with the chest x-ray findings of enlarged lymph nodes, which is also called lymphadenopathy. The patient also has pain in her joints, so that's called arthropathy, and specifically associated with sarcoidosis, it's called Lofgren syndrome. Another thing is the erythematous lesions that are tender to palpation on our bilateral lower extremities. These are called erythema nodosum. And then we also have hypercalcemia, which is not mentioned in this patient, but it can happen because you have increased alpha hydroxylase. And so if that occurs, you can have hypercalcemia, and they might actually go ahead and give you the symptoms of hypercalcemia, so they can make you work a little bit harder too. And so moving on, we have elevated C-ANCA. So this is in the case of granulomatous with polyangiitis. So for this one, we have lesions in the lungs and the glomeruli. So the pulmonary and renal systems would be involved for this condition. And then for this one, it's more associated with purpura. And we also have an overlap of arthropathy. But the thing that would distinguish it is once you saw that there was hilar lymphadenopathy, then you wouldn't really consider granulomatous with polyangiitis, just because that finding on chest x-ray is really associated with sarcoidosis, and they're probably trying to push you towards sarcoidosis if they give you that chest x-ray finding. And they might just, instead of describing it or saying it in the problem stem, they might give you a picture of a chest x-ray. And next we have hyperglycemia and hyperuricemia for the two other options. So these would just be associated with diabetes and gout respectively, and wouldn't really deal with this type of question. So just to recap, we have a patient. So this is like the typical patient. We have a young woman coming in with joint pain. She also has a dry cough, which is also due to this condition, and shortness of breath. And then they give you a description in two forms. So one is going to be the erythema nodosum, and the other is the chest x-ray findings. So just knowing all of this leads you to the diagnosis of sarcoidosis. And then the final key is knowing that sarcoidosis is associated with elevated angiotensin converting enzyme. And so I hope that helped, and thanks for watching.